Ready to get started? Here, I have your bio on my phone, but I'll just try and go from memory, which is, it's not great, but we've seen the flyer. So welcome, everyone. I'm Sarah Allen. I'm Associate Professor at the Institute of Health Policy Management and Evaluation up the street in the Health Sciences Building, which has no air conditioning right now. And so we moved, but lucky for us, we're in this beautiful space at Rotman, and it's really well suited to today's talk because of our speaker, and the subject matter really fits well with the work that's done here at Rotman. So I'm the director of the North American Observatory on Health Systems and Policies. Many colleagues and friends of the NAO are here, and we're really pleased to launch this, to host this NAO lecture today. And as is our custom, we all often look to other jurisdictions for new ideas and insights. And one of the things we often look to England as one of our sort of most similar, most comparable jurisdiction. And I was particularly struck by this topic because we're often criticized in Canada for our lack of creativity and lack of kind of sometimes called policy capacity to innovate. And this seems like one of these really interesting case studies of a potential tool that we could adopt in Canada to overcome this kind of resistance or challenge in bringing out new policy tools or new levers for change when governments might be reluctant to do so. And so how can we leverage philanthropic sectors and other sectors in order to bring about health improvement in an innovative way? So I'm really thrilled to introduce our speaker who's come from England. He's Alec. Fraser is an associate professor of public policy and management, I think, at King's College London, and has worked in the NHS as a someone who's managing the health system from inside, but also an academic, which is really in the spirit of what we do at the NAO as well, working closely with and embedding ourselves within health system decision-making roles. And Alec has studied outcome-based contracts and social impact bonds for many years. He's contributed to textbooks on health policy. And today he's going to be sharing work that from a long-term case study that's one of these innovative tools that we might hope to learn from in terms of how we can what is a community transformation fund? How can we partner with philanthropic sectors to bring about change? So we're really thrilled to invite you here today, and I'll turn it over to Alec. We'll have almost an hour for the presentation and Q&A. So I don't know if you take questions of interruption in the middle, but interrupt him if you're unclear on something, because sometimes words get lost in translation across the pond in terms of the terminology we use, and if you're confused or unsure of what the Canadian equivalent might be, you can ask Alec to clarify, and then there will be some time for discussion. And please help yourself to snacks. We've got tons of food, and we're really excited you're here. So please allow me to introduce Alec to give our talk today. Thank you.
Thank you very much, Sarah. It's really, really nice to be here. So Steph asked me to talk for about 35 minutes, so that's what I'll aim to do. But we'll see how we go. So I'm a researcher from the UK who's been doing quite a bit of research on social impact bonds and innovations in terms of financing, particularly health-focused interventions over the last few years. So this talk today is a talk which is based on work that I've been doing for the last couple of years, really. So I've been working quite closely with a couple of non-academic organisations, and it's work which is done with my good colleague Claire Fitzgerald. So it's joint work that I'm presenting on our behalf today. And really this is a piece of work where we're trying to look at some of the positives and the negatives of social impact bonds, and working with partners from the voluntary sector, a large charity, and some intermediaries who've been involved in pushing the social impact bond or the SIB agenda in the UK, thinking about how we can maybe adapt the model and iron out some of the issues with it. Okay, so yeah, in terms of acknowledgements, just to say that this is work that Claire and I have done together. And also one of the things I'm going to kind of talk about is the positionality that I kind of find myself in doing this kind of work. Because this is kind of co-produced work with an organisation called Social Finance, who've been pushing social impact bonds in the UK. And also just to acknowledge that our time, Claire and my time, has been part funded by the UK charity, who we've been working with, and partly by King's as well. So thank you to them for that. So in terms of an outline, I want to start with giving you a bit of, well, just kind of outline the three main problems that I think that community transformation funds, which is the idea I'm talking about today, I want to give you a sense of what the main problems are that this new way of doing policy is trying to solve. And then I want to spend a bit of time telling you a bit about the context into which this new idea is kind of being introduced. So I'll tell you a bit about the UK context over the last 10 to 15 years. So I don't know if you know, but we're about to have an election in the UK in about 2 weeks' time. I think it's important to understand that context for the need for doing things differently and some of the strengths and weaknesses. So I'll talk then about social impact bonds themselves. Just as a show of hands, who knows what social impact bonds are, has heard of them before? I know we've got James, we've got Steph, and a couple of others, but most people not. So that's absolutely fine. So I'll spend a bit of time explaining what they are. And then I'll spend a bit more time talking about the strengths and weaknesses of social impact bonds, because I think they do have some strengths, but they have some real weaknesses as well. Hence this work to try and think about a different way a modification of this model. So then I'll come on to talk about community transformation funds and how they might work. And then I'll also talk about how we might implement them and how we might evaluate them. So it's work in progress. As I say, we've been working for a couple of years, but it's been quite slow work to get things going. And then I've got a slide at the end where I'm going to kind of come back and reflect on, this issue of positionality, really. So Claire and I are working as learning partners with these organisations, these non-academic organisations, which is very different to the evaluator role that Steph and I had. So Steph and I worked together in London for 5 years on social impact bonds, but very much as evaluators, kind of paid for by the government to feed back to the government about the potential and the pitfalls of this policy. The learning partner role is a bit messier, it's a bit more ambiguous, and can be uncomfortable. So I want to talk a little bit about that. And then the other thing to think about is the transferability. Do we think that these things have potential for the Canadian context? So just quite randomly, we had a talk on Monday in my department from Jean-Louis Denis. He came over from Canada to talk about us, to talk to us about his work, and it really got me thinking about the parallels between the countries. So it might be something to discuss later on. Do we think this is something you might be interested in, or something you want to run a million miles away from? We'll see. And as I say, any questions or anything which is unclear, just stop me at any time. Okay, so let's start with the problems. So there's three main problems, I think, that community transformation funds might be able to start solving. So in the UK, we've got a very long-standing issue of poor integration between the public, NHS, public sector, and the voluntary sectors in UK health policy. So this is very long-standing. So I worked in the NHS throughout my 20s. And it has a very public ethos. We're often very reluctant to work with our voluntary sector partners. But I think there are certain things that the voluntary sector can do better than the public sector. That's something I think I've learned through doing this work over the last 10 years. But institutionally, culturally, it's very difficult to get those connections. The second thing is scarcity of funding for personalised services. So I'll talk in the next slide or so about the kind of social economic situation in the UK over the last 10 years. So even if we can get these institutions to work together without proper funding, it's very difficult to get projects off the ground. And then the third point is something I think is probably the same in most systems. We've failed really in the UK to prioritise prevention, and we don't often enough think about long-term outcomes. We'll often think about inputs, we'll think about outputs, but not outcomes. And hopefully this work is trying to address some of these three problems which we see certainly in the UK. So this is a slide I've shown in a few places, and it just tries to give you a bit of context about the UK. So, and having listened to Jean-Louis earlier, you know, it really struck me some of the differences between our countries. I'm just going to try and get the screen to go away. All right, sorry. So in the UK, so unlike Canada, you know, we're very centralised. We don't have a federal system, we've got a kind of a unitary system. The government in London, in Westminster, is very dominant. Thank you, Seth. So central government is very strong. Local government remains really quite weak. And if you look at this graph here, this is something known as the Barnett graph of doom. So this is quite a famous graph over the last sort of 10 years for health and social policy analysts in the UK. So this was designed by some analysts back in the early years of the coalition government from 2010. So just for context, so we had a new Labour government from 1997 until 2010, which put a lot of money into public services. Financial crisis, 2008. We then get a new government, a Conservative Liberal coalition from 2010, which we've had right until probably 2 weeks' time. And in 2010, the new government came in and said they had to cut budgets for local authorities. And what this graph shows is the amount of money that governments would have from 2010 up until about now. And so you can see this red line shows you that it's coming down over that time. And also, if you look at what local government does, the dark blue is adult social care and the light blue is children's services. So if you go back to 2010, just over half the money that local authorities had went on these things, and they had, you know, the rest of the budget for, you know, for leisure centres, for libraries, for public transport. Over time, as the amount of money has come down, the pressure with an ageing population has gone up to the point where really now all that our local authorities are able to focus on are these two issues. So we've got a real kind of problem. It's really stark, the effects of government austerity since 2010. So we've got huge regional variations in economic activity. So the southeast is pretty productive. The rest of the country less so. I think the UK was impacted probably more heavily than most countries by the financial crash in 2008. We've also had Brexit, which has made everybody poorer during this time. We've also had, like I'm sure you have as well, you know, high inflation following the Russian invasion of Ukraine. And so overall, it's been a bit of a lost decade. The UK population has got sicker, it's got poorer during the last decade. So we're now left with quite a high tax, low growth economy, which I think is why people are talking like a kind of 1993 Canadian kind of collapse of the Conservative government potentially in a couple of weeks. So it's worth keeping an eye on, because I think it is potentially going to be really historically bad for the governing party. So that's the kind of economic and social context. Then I want to share this slide with you. So my PhD was focused on health service reconfiguration. So one of the things the NHS does very frequently is it has big structural reconfigurations of how we organise health services. So there was a big reorganisation in 2012, which moved towards more markets, which has generally been seen as a big failure. So in the last couple of years, we've moved back. We're now focusing more on collaboration. And the latest iteration is something called integrated care systems. And the idea is to try and bring commissioners and providers closer together. And so essentially in England, we have 42 different regions. Each has its own ICS, or integrated care system. And so it's actually quite a good time to offer some new thinking to policymakers. And I think generally in health policy circles, people are often resistant to change, but I think people actually, generally, there's quite a lot of support for this new model. So there's opportunities, again, to think about how we can get statutory services, the NHS, local authorities, to work more effectively with the voluntary sector right now. Any questions about the context or the structure of UK kind of health policy before I move on? Does that all make sense? Yeah? Okay. So I'm going to spend 10 minutes or so now talking about social impact bonds. So on the understanding that most people have not heard of them, or may have a very kind of underdeveloped understanding of them. So 2010, so this is David Cameron, who was the new Prime Minister back in 2010, and he looks very young. He's now the Foreign Secretary. He looks, as we all do actually, older than we did 15 years ago. And one of his big policy ideas was something called the Big Society. So he kind of came in and said, well, we can't afford to keep putting lots of money into public services. We need to cut back. We want more diversity in terms of providers. We want to draw on the voluntary sector more than we have. And I think there were some good elements to this, but I think it was always stymied by the fact that they were taking so much money out of the system through austerity. But one of the ideas he wanted to kind of push forward was this idea of social impact bonds. So social impact bonds were originally an idea of Gordon Brown, who was the previous Labour Prime Minister, who never really got round to doing anything with them because he had to face the financial crisis. But David Cameron kind of came in and said, this is something we're going to push. So in terms of what social impact bonds are, when I teach kind of public management reform to my students, I often start with kind of traditional public administration. And a traditional public administration model, in very simple terms, looks a bit like this. So we've got the government directly delivering services to a population. So if you think about the original NHS model from 1948, it's very much, Whitehall, the state, directing the services with lots of control. So this fits until the kind of the 1980s, when we get the new public management reforms. And so we've got less of a focus on kind of the inputs and what government's doing, and a shift to think about outputs. How much value are we getting for the services we've got? So we get a slight change here. So the government's still in control, but it uses competition to get quasi markets, get a kind of an internal market working in, say, the health service, to try and deliver services for the population. And we also see a bit more diversity of providers, so more use of the voluntary sector. And we see a proliferation of lawyers and other administrators who are kind of administering these contracts. So things get a bit more complicated. And this is the kind of model which we've kind of really had over the last sort of 40 years. So how does the social impact bond model change? So one of the things that I think is very attractive to most people about social impact bonds is that there's a focus on outcomes rather than inputs or outputs. But it's quite a different model, because it starts, traditionally, a social impact bond starts with investors rather than the government. So you've got investors who may be socially minded or financially minded, will come together with intermediary organizations to think about potential problems that they might be able to explore how to solve. They'll put some money in, and rather than going straight to the public sector, they'll generally get voluntary sector organizations to work as the key providers, often in collaboration with public sector organizations. Another element of the social impact bond is that services should be more personalized. They should be more tailored to individuals who need those services. A further innovation is an increased focus on evaluation. do these interventions, do they work? So this is where people like Steph and I kind of came in. We were asked by the government, 10 years ago to work as evaluators to try and give some feedback on the evidence of outcomes to government. And then if the government is happy or satisfied that the outcomes are good and that they're attributable to the intervention itself, then the government will give a return to those initial investors. Okay, so that's the basic principles of social impact bonds. So social impact bonds are quite politically contentious. Okay, there's a lot of people who in the early days thought that these were, the best thing since sliced bread. Do you say that in Canada? You do? Okay. So that these things would revolutionize services. They would be a win-win-win. So we would get better services, better outcomes for service users. We'd get cashable savings for the government, and we'd also get returns for investors. Really, really, this is something which is going to kind of revolutionize potentially how we deliver services. At the same time, as you can probably understand, there were a lot of particularly academics who were looking at this, who were really concerned about some of the ethical or political implications of social impact bonds. So say one of the social impact bonds have focused on homeless people in London. So Steph's PhD kind of focused on this. And some people might say, well, it's ethically problematic for investors to be making a profit out of homelessness. So there's been a big kind of debate in the academic literature, saying that these things are really quite problematic. So over the last 15 years, really, we've had this kind of battle between these two different sets of ideas. So what we can say is over this kind of last 10, it's really 15 years now, these are a number of different projects that Claire Fitzgerald and I have worked on, mostly in the UK. So it's just for context, there's about 300 social impact bonds in the world, and the majority of them are in the UK. We've got some in the US, we've got quite a few in the Netherlands and Portugal, more patchy in other European countries, not really taken up in Canada. Which we can maybe kind of think about. So anyway, kind of building on this research, we can kind of point to empirically what if we start off with this narrative of people saying they're great and other people saying they're awful. What can we say empirically from the studies which have been done? So I think the first thing to say is that both these original narratives I don't think have been fully borne out. They haven't revolutionized services, but neither have they really led to mass scale financialization or assetization of public services. So I think it's a more kind of ambiguous picture, kind of somewhere in the middle. In terms of successes, I think there's some evidence that SIB financed interventions can be more effective than non-SIB financed interventions, with some caveats we can maybe talk about. I think it's also increasingly accepted that social impact bonds can lead to much more effective collaborations between different sectors or different actors, so public, private, philanthropic. And also there's evidence from organisations who've been delivering social impact bonds that they, particularly voluntary sector organisations, they will generally have longer term contracts, which can be nice. They will have often more money to spend on service users, which again is something which they value. So this kind of stability and increased funding are certainly seen as something quite positive. On the negative side, there's a number of observations that we should turn our attention to as well. So really key, I think, is there's no evidence that SIBs are really generating the kind of cashable savings that were originally promised. There's hypothetical savings in some particular projects we could maybe think about, but overall, I think they're probably costing more. And so very few people are making this argument that they're going to kind of deliver savings anymore. One of the attractive things originally was this rigorous measurement. We really find out what works and what doesn't work. Again, that's quite expensive to do. It's not necessarily everyone's priority. We've kind of lost that, and we've got much more of a kind of a rate card approach where government talks about proxy outcomes and pays out on those. We've seen lots of evidence of gaming practices, which we might expect from the kind of economics literature. There's a lovely point that Jesse Hager makes in his work, that there's a surprising lack of civ finance projects that don't pay out. So often I think we're paying for services, paying a return to investors when perhaps we shouldn't be. And there's also some evidence that the public sector and people in the voluntary sector feel uncomfortable about investors making a profit through some of these projects. So it's quite a balanced, I've tried to give you a balanced account really of what the literature sort of suggests over the last 10 or 15 years. I'll just stop there. Are there any questions about social impact bonds or anything which was unclear? Yeah.
I was wondering, what is the time frame of like this whole cycle of going on and turning back to investors? How long does that usually take?
Yeah, that's a really nice question. So the question is, what's the time scale for social impact bonds? And they will be different, but I think most of them would be probably 3 to 5 years. And again, if we're thinking about long-term outcomes, keeping someone who's been living on the street, getting them into permanent housing, it might be a bit premature to start paying out on outcomes after 2 or 3 years. But again, compared to how the system before, where charities were being paid to deliver a service maybe for 1 year, having a 3-year contract is something which they really like. But there's one, so Ways to Wellness, so a project in the north of England, had a kind of a 7-year social impact bond and has been really well measured and has, my understanding of the latest results, it's been really quite effective. So some of the longer ones and some of the ones which really focus on measurement tend to, I think there's a case for them, but some of the others are very short and aren't really measuring outcomes. Yeah.
I don't know anything about social impact bonds until now, so just for context, how do the investors choose which programs are funded? I'm guessing the government doesn't have a say in that, so the investors do, but how could one project be chosen over the other, even if it's around the same topic, like homelessness, for example?
No, it's a really good question, and they're very different. So for some of them, the investors will put their money into an overall outcomes fund, and they will then get an organisation to administer that for them, choose the projects and do everything. There are some others where an investor has a real passion for a certain issue. So I did an evaluation on opt-out testing for HIV in South London. And this is a project that the main investor was actually the Elton John AIDS Foundation. So, they really got a passion for reducing HIV transmission. And for that one, they were the main investor. They had a couple of smaller investors, but they had a passion for this issue and they drove it. And for me, that's probably the most successful one that I've looked at. So they'll be quite different. There is government money as well. So in the UK, the reason why the UK has so many compared to other countries is the government has subsidised a lot of them. We have things called outcomes funds, where the government will give some kind of top-up funding, which makes it more economically viable for local government to get into this kind of work. There's a brilliant database called the Indigo database, which is hosted by the Government Outcomes Lab at Oxford, which gives you all kinds of information about every single social impact bond, who the investors are, the time frame, and this kind of thing. So if you are interested, go to the Government Outcomes Lab website. They've got a brilliant resource. Yeah.
How significant are the costs associated with fund management?
Very good question, and we don't really know. We don't really know. So there's still a lot we don't know about SIBs. We know anecdotally the kind of rates of return, which are very high in the UK, less so in European countries. But there's a lack of transparency around things like that. We know that the overall transaction costs are likely to be much higher than they would be under a conventional approach. But yeah, there's a lack of published data on things like that. But it's the right kind of question, I think, to be asking. So I was going to go on next, if it's okay, and kind of talk about this new development, community transformation funds. And I'm probably going a bit slower than I thought I would. Is that okay? Yeah. So community transformation funds are an idea that my colleague and I have been working together with a large charity in the UK and one of these intermediary organisations called Social Finance. We've been working with them as learning partners about thinking about how we can minimise some of the downsides of social impact bonds and potentially maximise some of the positive elements. So we've been doing some work where we've gone to a number of kind of small voluntary sector organisations delivering healthcare interventions across the UK, particularly in England, actually, and kind of asking them about what are the barriers that they face to improving the work they do, kind of working more closely with the NHS, delivering better services. And these are the kind of things that they said they were struggling with and they'd like more support with. So greater capacity building, an ability to kind of influence and have more partnership, working between the statutory sector and the voluntary services organisations, more funding support, longer term support, consistency, stability, some really basic kind of capabilities around fundraising, IT, information governance, better data capacity, procurement readiness. So a number of elements that you probably aren't a surprise. These are the kind of things that small organisations often struggle with. And so we've taken these ideas away and done some time thinking about what we could do to try and solve some of these issues. And in a way, the Community Transformation Fund is it's a double innovation. Part of it is a fund, a kind of a national fund, which has money put into it by charities. And the other part is kind of local management, or the charity we work with really likes this idea of being an anchor organisation. Is that a concept you've come across? Anchor organisations, yeah. Okay, so I'll say a little bit about that, but I'd be interested to see what you think. So these are the two elements of this. So what does the fund do? So the fund functions at a national level. And the idea is that the funds, so there's no private investors involved in this model. We kind of learned that there can be resistance to that, and there can be ethical issues with the involvement of private investors. So the funds are actually provided by very large national charities, and there's no requirement to deliver any kind of return on the investment. In a way, they function like forgivable loans. So that's the kind of principal thinking. And the funds will be tailored to a specific integrated care area, so for a population of maybe 1 million, and they will be used to support the local voluntary sector organisations to improve what they're doing locally. And we're thinking they should be running for about 3 to 5 years, probably 5 years if we can. So that's what the fund is. In terms of anchor organisations, there's a big literature on anchor organisations, and traditionally anchor organisations are seen as large universities, hospitals, big employers regionally, organisations that can't move anywhere else, who have kind of big sizable assets that they can use to commission services locally, this kind of thing. And currently, as far as we're aware, certainly in the UK, we don't have charities acting as anchor organisations. And I think the charity we're working with is quite keen to take on this role. So what will the anchor do? So we've got kind of 3 C's, if you like. So the first is about connection. So acting as much more of a kind of a convener or a bridge between the local NHS and local authority bodies and small charities, and kind of bringing them together, trying to break through those institutional barriers. And also strengthen the links between local charities. There's issues around data sharing and access as well, which we know is an issue for small VSOs. Secondly, capacity. So giving, localized funds, so having a community chest approach, more money for organizations to use to develop ideas and bids for further work. Kind of floating mentorship to try and help upskill the organizations. And then we've also got capability, so building capability for long-term growth of the sector, using kind of skills training, a skills portal. And also, I think one of the things that success might look like might be linked to increased consortia bids, getting very small charities to work together a bit more to raise funds. So how does this compare to what I showed you before? So, I showed you traditional public administration, then new public management, then the social impact bond. What's the difference here? So I suppose the first difference is it starts with charities. So there's no investors in this model. So they're working with intermediaries, coming up with resources, but rather than funding one organization, they're trying to get multiple organizations to work together. Again, to deliver personalized services to a population. Again, we keep the importance of evaluation there. Outcomes go back to government, and basically government will then, if they're happy with the services that are being delivered, will return some or all of the capital to the charity to recycle the funds, but there's no return on any investment. So it's taking some of the ideas and rejecting other ideas of the social impact bond. This graphic is another way of representing that. So just kind of gives you a sense of who the different organizations are. We might have a number of different projects which would be funded by the fund. So another question is, what kind of interventions might this model support? One of the things with the new developments in the health policy landscape in the UK is trying to devolve decisions to a more local level. So I think these will be locally negotiated. So for some areas, it might be to do with smoking cessation. For others, it might be something else completely. To give you a sense of the kind of things we've been working with one ICS in just north of London, working on anticipatory care models. So essentially, people in their last year of life trying to coordinate their care so that they're not going in for unplanned admissions. So these are the kind of things we might see the model used for. Also, social prescribing projects are becoming increasingly popular over the last few years, and there's likely to be some projects as well that might be linked to the goals of the different charities. So it might be cancer, it might be dementia, for instance. So in terms of next steps, as I mentioned, we've got a small number of ICSs who seem to be interested in piloting some of these. So we need to do some work around kind of co-designing outcome measures, and then eventually trying to develop a mixed method kind of evaluation of the services. Okay, I just wanted to finish with this final slide on positionality. So I've not talked to Steph about this either, but I wonder if you're in a similar place. So it's been really interesting and James actually as well, because you've looked at this for a long time. To look at this policy area over 10, 12, 14 years, you can see how you get these shifting champions and critics of the policy over time. I think it can be quite an uncomfortable place to be researching because it's highly politicized, it's very polarized, particularly earlier on. Some of we got a lot of negative feedback from some stakeholders if we were critical. But on the other hand, now kind of working as a learning partner with some of these organizations, I sometimes feel, am I kind of conflicted? Is it, this kind of idea in, should we be kind of, engaging in activist scholarship or keeping our objectivity as much as we can? Is there a danger, of kind of spending lots of time with people, drinking the Kool-Aid? How do we kind of negotiate these things and working as a learning partner rather than an objective evaluator, where you kind of know where you are? I think there's more that you can do as a learning partner. You've got more control, but that, I think it must impact on your kind of objectivity. So those are some of the things I'm thinking about now, which may or may not be of interest to kind of discuss further. And then the final thing was, how about Canada? Is this something you want to run away from, or do you see anything here? Have you got similar problems that this kind of thinking might be useful to consider further? So I've gone over time, but I'll stop there. Thank you.
Moderate some questions, and feel free to get some more food while we're having questions. But that was an excellent talk. Thank you so much. I've got a few questions, but maybe we'll turn it over to the room first if anyone has any that they'd like to. So I don't see any other hands up, and there's lots of snacks to enjoy. So let's please join me in thanking Alec for a wonderful talk, enriching and inspiring, and gives us lots of new ideas to take back to our own context. So thanks so much for an excellent talk.
Thank you.